To begin with, this talk is on anthropology of health, how we can develop our career in anthropology of health. Health is a very wide topic, and it can encompass various other disciplines. If you look at the how scientists working in health domain, what are different approaches we use for handling the or answering research questions pertaining to health. And health is a very interdisciplinary topic. So to begin with, I would just to introduce how we see or what kind of research questions we ask in anthropology of health. I can give you a few examples, and these examples can give you a hint, an idea of a perspective on how to think in anthropology of health. I think questions like how the Indian states can reduce the maternal mortality rates. Maternal mortality rates are very high in India, and if you look at the global burden of disease data, you'll find that it's a second most in terms of rank, the second rank in terms of mortality, maternal mortality or morbidity in India, and given the rural Indian landscape, which is very high in terms of population size and the amount of opportunity they have in terms of healthcare facilities, there can be different kind of research questions one can ask pertaining to maternal and child health. Then if you look at the disability factors, then one can ask questions like how disability can influence the economic well-being of the households. If you look at the burden of disability in India, you'll find that on the movement disability is amount to about 20 to 30% of all kind of disabilities in India. And disability is not just a problem or a chronic disease, but it's also a problem for the economic well-being of the entire household, because an individual living in a particular household setting, that person may be not only suffering himself, but the family members also have some sort of adjustments they have to make in order to cope up with the disability within the household. Similarly, examples like stunting, which is a very big problem in India. Almost 35% of children below 5 years of age, you'll find data says, the global burden of disease data says, are stunted in India. So what are the risk factors of childhood stunting in India? Of course, we know it's all about related to malnutrition, dietary habits, feeding practices, childhood care, socialization process involved in childcare. These are the factors, but how intricately they are involved with the culture and social milieu of the different ethnic groups or the populations living in different parts of India. Then there are examples like suicide rates, for instance. If you look at the suicide rates data, you'll find that in 2016, almost more than more than 2 lakh individuals died. 2 lakh suicidal deaths were reported in 2016, and so why these suicidal death rates are in India are very high, and what should be the India's strategy to prevent suicides in India? So these are the few questions I give you an example. There could be some different questions also, which one can ask in pertaining to health, and I think health is such a vast topic and such an interdisciplinary topic that one can approach a particular aspect of health in different manner. Economists, statisticians, sociologists, social scientists, medical scientists. And since majority of the students are from anthropology background, we can understand that we are dealing with, in anthropology, we deal with populations. So actually the subject matter or the unit matter of study in anthropology are populations or the groups, in contrast to the medical scientists who are focusing on individuals. So all the questions which I'm discussing or giving the example of under the banner of anthropology of health are pertaining to the populations only. Of course, we get data from individuals, but in the end, all our inferences, all of our statistical models or propositions are based on populations. Then there are social factors, contextual factors which can explain. So question would be that what are the contextual factors that can explain the gender inequality with respect to the educational attainment of the child, because there are various cultural factors which are involved in terms of the mechanism of decision making within the household for not sending the child or restricting the child's education, especially with respect to the gender roles. Then, if you're coming to the field of genetic and epigenetic epidemiology, questions could be: what would be the genetic architecture of type 2 diabetes in India? What is the heritability ratios or the rates of obesity? Similarly, if you look at the respiratory disorders like chronic obstructive pulmonary disease, one can ask questions pertaining to that also. That what are the heritability estimates for COPD in India? And what is the genetic architecture or underlying genetic variants related to the COPD or diabetes or heart attack or cardiovascular disorders or obesity for that matter? So it's a field in itself, which is a sub-branch of anthropology of health, or you can say, or public health. And then if you look at to the social factors, I'm giving you examples which are coming in my mind, and you can correlate with that, and you can ask questions pertaining to some other questions if you have in mind later on. Then there is a rising technology we use. We're using mobile phones. We are now driven by technology, heavily driven by technology. And believe me, we are living in a very, very different world. And this world is completely different if you look at the world in 90s or in 80s. Completely different world. And of course, different. I mean, there are many things which are easy today in contrast to what technology available in 1990s. But this exposure is a very big exposure, huge exposure in terms of health. So what are these technologies? So what are the factors which are related to this technology or the virtual world, which are associated with adverse mental health outcomes or the disorders? Rising level of depression, schizophrenia, anxiety levels, aggression levels, which are leading to road accidents, which are again related to the disability factor. Then if you look at the environmental factors, it's another sub domain of anthropology of health. That when we know that there are various environmental factors like water pollution, air pollution, toxic gases in the environment, these are the environmental, which are natural environment I'm talking about. So if we look at these factors, these components of the natural environment, water, air, food, diet, and the rising level of toxicity in every aspect of environment, how can we convince the policymakers to make a stringent policy so that we can control or at least regulate the consumer products which are consuming in the current environmental situation? I give you an example that if you look at how policymakers, how people working on anthropology of health or the public health scientists have convinced the policymakers that almost 1.67 million deaths are attributable to air pollution, which is why Delhi government, or you look at the central government, is focusing on air pollution. So what kind of evidence we need to convince the policymakers to address these environmental health issues? That could be good subject matter of research for people working in anthropology of health. Then what could be the modifiable social or cultural factors that can be useful in improving the health of the elderly population? It's a highly neglected population. If you look at the most of the focus of the policymakers is on maternal health, child health, adult health to some extent, but the elderly population is the most neglected population in India, and which is why sometimes the amount of disability, vulnerability is very, very high. So I'm not giving you examples of specific population, for example, tribal population or A or B population in different states, but I'm giving you categories with respect to the age, gender, sex, the occupation, various other categories we can make depending on the various social categories I'm talking about. Then what would be the urban-rural differences in healthcare utilization, especially by the elderly population? And we have seen that healthcare facilities are available, but they're not affordable. Not affordable not only in Delhi, but various different parts of India where people have limited monthly income or out-of-pocket expenditure. They cannot manage such a high-cost hospitalizations or healthcare facilities. And moreover, if you look at the rural part of India, you don't find there's a lack of availability of these facilities. So these are the few questions I think which will help you to understand the scope of anthropology of health in India. So I give you example of urban-rural disparities, environmental health, socio-cultural factors, contextual factors, then role of gender inequality, poverty, all these factors one can study. And beauty of anthropology is the holistic approach, and all of you are trained in that or going to learn those things in future. So now if you have a good sense of so what is the subject matter of anthropology of health. So these are the questions which generally people ask, and there are in India you can ask n number of questions. There's no dearth of questions in health, because everything is related to health. And I personally believe that there are so many ministries in government. Every ministry must be the health ministry first. For example, if the Ministry of Health is already there, the Ministry of Urban Development must be a Ministry of Health and Urban Development. At least, if not in name, at least in terms of strategies. For example, if there is a urban planning, you must keep in mind the health of the people while planning the urban landscape. Similarly, rural planning, sanitization policies, Ministry of Injustice, Social Justice, all these ministries, I think the Finance Ministry, the Home Ministry, every ministry must be a health ministry first, at least in their approach, because health pertains to every aspect of governance. And so our research must focus on what are the lacunae, what are the gaps in particular society or culture, and how can we use these gaps as an instrument to convince the policymakers in different ministries. So you should not focus on that only our work is pertaining to the health ministry. Our work could be related to the finance ministry, but it could be a financial policy which has consequences on health of the population. Now, the question is where this subject has been taught in India. So there are departments of anthropology. Of course, in University of Delhi, we have very much focus on anthropology of health. In Calcutta University, you will find faculty members who have good interest in anthropology of health. Savitribai Phule University in Pune, Punjab University, there are faculty members. In Manipur, there are a few. Rajiv Gandhi University in Arunachal Pradesh. Few of them are also interested in Hyderabad University School of Social Sciences. Apart from real public health institutes or departments, I'm only focusing on anthropology departments here. Then, what are the different? Since this is on career, what are the kind of different careers you may have if you choose to work upon anthropology of health? Then I think there are domains of health where one can make career. Like you could make your career in health policy and planning research. For example, what are the mother's experience during delivery care? What is the government policy for maternal health care? So one can intervene or one can study a particular healthcare system in order to improve maternal or child care within the hospital I'm talking about. So and those findings can be shared with the policymakers. So it's a full-time career one can make in health policy and planning. For example, universal health coverage. It's a big strategy. I mean, very big policy for health, which the present government has rolled out. And that means, 5 lakh rupees insurance is given to everyone, especially the poor people, and which can at least ensure or at least improve their capacity to spend some money on their health. So it's kind of insurance policy, and it's a very, very big policy and very ambitious policy also. And I think India will gradually, if India implements it properly, of course, it will take 5 years, 10 years down the line. One can understand the various limitations of this policy, but it's a very effective and very important policy for me as a public health scientist. And I think then there is one more area in health policy research is distressed financing. People borrow for their healthcare management, borrow for hospital bills. So this is known as distressed financing. So that how people are borrowing for managing their health, which is due to the high level of out-of-pocket expenditure, health expenditure related to the hospital bills and or the pathology lab bills. So this is one kind of area, one area where one can make their careers. Then you could be a full-time public health professional, where you can study the distribution of disease, the causes, the risk factors, consequences, prevention, and the treatment strategies of those people who are living with disease. This is the, epidemiologist or public health scientist. Then if you want to make your career in genetic and epigenetic epidemiology, then you have to focus on what are the genetic factors associated with diabetes, cardiovascular disease, COPD, asthma, chronic kidney disease. You should learn various laboratory techniques. One can also make career in epigenetics also. Of course, it's a combined area. For example, if you want to study the association of quantitative DNA methylation with diseases, these are the questions we ask generally in epigenetic epidemiology. Then one can also make career in healthcare education, where you act as a specialist to educate people. For example, there was one education based on, this is one study which was based on the impact of multi-component physical activity initiative or education program in school children. Because if you have to prevent obesity, we have to first educate the school children about the relevance of physical activity. So these are the healthcare education programs. Health education of the pregnant woman, and about their how to manage the pregnancy, how to manage the gestation period, which is a very dynamic period. How a pregnant woman can effectively manage the period of gestation, how the family members have to behave during the pregnancy, and what are the different child outcomes which are directly related to the gestation period. So educating the mother, educating the in-laws, educating the husband about these these basic health parameters. Then, for example, if you look at the COVID example, you can look at the how government have educated, the amount of money government has spent on educating the people on vaccine efficacy. So these are the things which comes under domain of health education in terms of career. And then and these sometimes people make their career in multiple options also, depending on the availability of the jobs, depending on the need of the institutions or the government institutions. Then there are careers like one can make their career in hospital management, administration, and there are courses also. Management courses in hospital management. For example, not only hospital management, but also the healthcare management. For example, India, if you look at this COVID example, the vaccination target which India has now, and India has already reached a landmark of 1 billion doses of vaccine against COVID-19. So to manage this vaccination program, we need people who have expertise in healthcare management. So this is an example of it. Then what are the determinants of the health of the senior citizens? So if you have to manage the health of the senior citizens, what are the components required to manage the health of the senior citizens in hospitals, in different small primary healthcare centers, tertiary healthcare centers, secondary centers? So and then the whole field of hospital administration also comes under this. Then you can also make career in bioethics or career in regulatory bodies. For example, if government is planning to roll out the vaccine, what are the role of, you can say, vaccination, and what are risks associated with it? What are the risks associated if people are not accepting the vaccination program? And you have to respect the freedom of the people also. So these are the areas of research where one can contribute in or make career in bioethics. Then medical care ethics is another field under this bioethics or ethical aspects of public health. Then education intervention trials. There are many randomized control trials related to diseases, related to the new drug trials. So you have to educate the people for that. And what are the ethics involved in all those trials, where the food interventions, some of the drug interventions, and there's one series on Hotstar also, human. There's a very recent series. You will find out how people, take consents. How there's a big field of bioethics actually. where one can make career and advise the regulatory bodies that these are not proper drug control bodies. And as Indian Council of Medical Research, you can advise them that you can make whole career in bioethics. Then there's another field of implementation science research, where scientists focusing on how to implement a randomized controlled trial. What are the strategies which are scientific strategies one should not miss while implementing a particular scientific program or the scientific you can say controlled trial or drug trial or educational trial in order to get the scientific evidence. So this whole field of implementation science, for example, how to implement appropriate health interventions at population level. So this comes under the banner of implement. It's a new field, very new field. People are very few individuals are working in this. But it's all related to the implementation of the research projects so that we get the very reliable results. We do not have to repeat these findings, repeat these studies again and again in different population, so that one study must be sufficient if you implement it in a proper manner. Then there's one more field of health promotion, which is the process of enabling people, so that if you enable people in terms of their education, in terms of increasing control and improve their health, in the end we are promoting health. For example, the government has a big banners of promoting health for vaccination, especially. For example, there was a study on elementary school based wellness program for the school children, so that they can prevent childhood obesity prevalence. So these are the few of the career options. Then I think what should be the different allied fields or complementary subjects one can take. And as I said, that this public health is an interdisciplinary subject, and and we need to think in a very interdisciplinary manner if you want to be successful in public health. For example, there are many subjects. For example, subjects like human physiology, human genetics, population genetics, psychology, social anthropology, sociology, because in the end, anthropology is a bioculture field, and it's a very right approach to study diseases, study the health aspects of life. And this is one subject which makes you very different from medical scientists or people who have career in psychology or psychiatrists, because your approach is biosocial approach. Because social perspective actually seeks to understand health as a feature of the rich, complex social culture. I mean, and the social surroundings, how these factors influences the health or biological or the human physiology or biological factors. Then the field of statistics is another important field where without which it's difficult to make career in anthropology of health. Field of demography, which studies mortality, morbidity, fertility rates. So if you have exposure of demographic aspect, fundamentals, it will be very useful to make us to be successful in anthropology. And then the whole field of economics, macroeconomic policies, microeconomic policies, how they influence the health expenditure, for example, determining the price of a vaccine in COVID-19. What are the aspects involved into this? So these are the work of health economists. Then the whole field of operational science. If you are rolling out a big project, what are the different operational logistics are required in implementation of those big projects? In the field of environmental science, where you must understand the dose-response relationship. What is exposure dose? What is the outcome of it? How people are influenced by environment? Environment is not only natural environment; it's all about the social environment, social networks of the adolescents, social networks of the pregnant women, social networks of the elderly people. So all these, and then the field of computational and informative technology. Nowadays we have apps for everything. We have apps for trials. We have apps for managing the cardiometabolic health. Now there's one app for yoga. There's one app for this one chronic kidney disease. How patients of chronic kidney disease, how they can manage using apps. You do not have to go to doctor again. Again and again. Once you have the stepwise information, detailed information on your one app, so you can manage your health accordingly based on the symptoms and based on the pathological reports from the laboratory. So working with and between disciplines always requires a kind of a constant explanation, adaptation, adjustment, readjustments from all the researchers involved in a research project. So these are you can say the applied complementary subjects, in which you may have some expertise, at least some exposure, to develop your career in anthropology of health. Then additional skills you may have. You may develop skills in the art of fieldwork or data collection. Sometimes we take this art of fieldwork very loosely. I mean, this is a very important art, and I think if you collect the quality data, then only you can make reliable interpretations or acceptable or valid interpretations. So art of fieldwork also collect the art of data collection, the quality data collection. It's not just the data XYZ data you have collected from the field. It's all about a high quality data collection. And high quality data collection involves statistical procedures, it involves money, it involves time. It's a very time consuming process, even for simple measurement like height. Yes, if you in one project we are spending, we have spent almost 15,000-20,000 rupees for apart from the instrument required for measuring height, just to get the quality data. And we train the manpower again and again so that we ensure that if they are measuring height, they shall measure height very appropriately. Same for body weight, same for other anthropometric measurements, same for other kind of questionnaire-based or schedule-based data you are collecting. Then you can also learn the art of data curation and the management. Once you have the data, I'm talking about large scale data. Once you have data on 1,000 individuals, so many parameters, how you ensure the data is of high quality, and how you deal with the missingness in the data, and how you manage that data, because there's lots of variation in the data. You have to first clean the data, and data cleansing process is a lengthy process. It takes some time. In one project, it took, I remember in Andhra Pradesh children study, it took almost 6 to 8 months, 3 to 4 people consistently involved daily. We give 2 to 3 hours on data cleaning exercise. And after 6 to 8 months, we have a kind of a data which is cleaned, which is reliable, which is acceptable. Then you also need computational skills. You also need to learn research ethics, because every aspect of health is related to ethics. First you have to ensure ethical aspect. You have to take ethical clearances. You have to ensure many aspects of clearances in terms of ethics, in terms of dealing with the patients, parts of the information sheet, consent forms. So then you also need the laboratory techniques if you make your career in genetic epidemiology or epigenetics or biochemical genetics for that matter. And if you're collecting biological samples, then you need to be trained in how to collect biological samples, how to preserve it, and how to use it for further later laboratory techniques. So these are the additional skills required for this profession. And there are different institutions which you can look at, and they hire people who are working in anthropology of health. Like apart from the basic university system, or you can say scientific institutions, there are institutions like Indian Council of Medical Research, Department of Biotechnology, Ministry of Science and Technology, then this National Institute of Health and Family Welfare, and the Ministry of Health, then Anthropological Survey of India, Indian Statistical Institute, Kolkata. They also hire anthropologists. Sports Authority of India, people who are interested in sport, health of the sports personals. Then public health organizations, NGOs, so many NGOs who are working on health. Then there are WHO health programs, big programs, health policy, promotion, advocacy. Then there are health-related big things of UNESCO, WHO, UNICEF. There are various private specialized laboratories, then companies dealing with healthcare technology. For example, there is you have seen the BP machine, Omron BP machine in every household. How these are point of care systems, how these point of care systems are reliable, whether they are acceptable to the people or not. So companies hire people working in anthropology of health or public health to a trial of these technologies, acceptability of these technologies. What are the limitations? What are the utility of these technologies? Whether it's usable by the people or not, or the consumer or not. So it's like a business model, but in the end, it's very useful thing to involve in these trials also, because in the end they are giving you a technology which is useful for improving people's life. So these are the few organizations, and there are many other organizations which comes under this banner of anthropology of health. I hope I give you some idea about anthropology of health and some career options you may have. Thank you.